As the Build Back Better Act continues to be held up in Congress, one nonprofit says passing it could help cancer patients. News 8 Now's Dua Israr spoke to one of those patients who says Medicare helps her with her prescriptions.
Cancer patients say health care should be a right for all. For Mariah Olson, Medicare helps pay for her prescriptions, something she says everyone should have access to. In the United States, cancer is the second leading cause of death.
It's hard-pressed to find an American family that hasn't been impacted one way or the other with cancer and having to battle that.
For those who survive, side effects from cancer treatment can create new health issues.
100 different medical conditions and symptoms and late effects from my treatment.
Issues that require medical attention frequently.
I see almost every specialty. I have diagnostics all the time. I've had 48 different surgeries.
Mariah Forster Olson was diagnosed with neuroblastoma when she was 1 year old. Neuroblastoma is a cancerous tumor that usually sits on top of a kidney.
Mine grew out of my spine, wrapped around part of my heart, and took up almost the entire right side of my chest.
Olson, who has since been treated for her cancer, now deals with the side effects of her treatment. Before she was covered under Social Security Disability, Medicaid, and Medicare, Olson and her husband had a copay for Olson's medications.
That was as high as almost $100. So when you take and get filled 30 prescriptions a month that really adds up.
The high cost of medication and copay caused Olson and her husband to go into credit card debt. She also began to skip doctor's appointments.
We could have missed some things in the past, and there were things that I probably should have gone in for but didn't.
The American Cancer Society says Congress should expand Medicare and Medicaid to make health care affordable in the state of Wisconsin.
38 states, individuals with limited incomes can now access affordable and quality health care.
The nonprofit says Congress should cap out-of-pocket prescription drug costs for patients in Medicare Part D.
That's one of the major cost drivers in the healthcare system.
Republican State Senator Ron Johnson says he believes in a healthcare system based on consumer choice and free markets that will bring Americans the lowest price possible. But Olson says the answer is simple.
Affordable health care should be a right in this country and not a privilege.
The American Cancer Society says they will be making stops to advocate for the act across the country.
All right, thank you, Dua.